Welcome, everybody, to Lessons from the Field. As you know, this is a series of interviews we do with a diverse array of guests who all have a common thread, and that is a passion for pharmacy and pharmaceutical sciences. And today we're featuring Christina Berberich, who is a PharmD graduate from 2012. Hi, Christina. It's great to see you again.
Great to see you.
Christina also has a MPH degree from UIC and is a registered dietitian, and she's currently head of regulatory and policy affairs at Bobby, which is a relatively new startup company. And she's going to tell us a lot more about it. And as usual, we're going to ask Christina a number of questions to gain insight from her on her experience since she left our program. And I'm sure that'll be very beneficial to our students who are listening and alumni and friends who might also join in. So let's go ahead and get started. Christina, if you could just give us a brief executive summary of your time since you left UIC.
Sure. Thanks so much for having me. Really excited to be here and discuss all of this with you today. So when I graduated in 2012, I actually moved directly from graduation into a regulatory affairs role at Abbott Nutrition. I think it was a really unique role in the sense that I didn't really have a regulatory affairs background, but I did have a background in infant formula and science and all the things that go into building products. So it ended up really making sense, and it was such a really lovely job. I did a lot of really cool things, including writing and submitting notifications for our products directly to the FDA, as well as kind of engaging my nutrition side with reviewing labels. And looking at claims and understanding kind of the depth of substantiation that's required to actually make product claims in the infant formula space, but as well in the dietary supplement and food spaces. From there, I actually I had met my husband in California and decided to take a remote role in the R&D world. And so I transitioned into a medical science liaison role at Abbott, supporting the adult side of the business. So definitely very familiar with medical science liaisons coming out of UIC, and really helped inform the business what the true role of a medical science liaison is in comparison to sales. And got into a lot of interesting issues around patents and trademarks and copyright and things that you kind of hear about, but as somebody in kind of this R&D development space, it's really important to understand at least the basics of a lot of this stuff.
Over your time now, since you've been at UIC, or even before, because you worked before, but what influenced you the most, I guess, along the way? You mentioned your time at Abbott and all of the people that put so much effort into helping you learn, but maybe reflect on that or other experiences that you had.
Well, I guess I'd have to say, thinking about the work that Bobby does about combating stigma among, parents feeding infants. I think back to one of the rotations that I did in pharmacy school, where I was in the Rush PICU. And I'd worked in hospitals before, being a dietitian, and but I think spent some time in PICUs, but nothing like this. And I think what was so interesting about this experience, I mean, obviously a lot going on in a PICU, a lot of really sick babies and kids. And what was, I think, something that I really picked up there was nobody really seemed to be looking at the parents. And I think the unique aspects of giving care to infants and children is that parental care
Mhm.
is
Yeah.
almost as important, if not more important, than actually caring for the child. And I think especially in situations that are pretty dire, like if you're not actually listening to the parent and going through the experience with them as an equal, it really,
Hmm.
it's already a terrible experience for them.
Yeah.
And so you can either add to that or you can be a support system. And I think about, there's so many parents, throughout the country that have to deal with feeding infants, feeding their babies. And granted, it's not a life and death situation, but at the same time, you have to feed a baby. And so when
It's a good
people
idea anyway.
when people go through these decisions of I'm trying to breastfeed and I can't, I you know I, we're same-sex couple and we wanted to purchase human milk, and we didn't realize how expensive it is. Or I have a double mastectomy and insurance isn't going to cover my breast pump, but it won't cover my insurance or my infant formula.
Mm.
There's a lot of issues in the general space of America where feeding is not it's not a fun journey for people. And we as not only as healthcare providers, but also as infant formula companies, we can choose to support those parents and be understanding in what they're going through, or we can just provide a product and walk away.
Mhm.
And I think, if we've learned anything through COVID and, being remote and reflecting on, the time we've gotten to spend with our families, is that really at the end of the day, family's really important. And, if there's anything we can do as a company to enhance people's feeding journeys and at least help them feel a little bit less guilty for having to choose infant formula, we've done our job.
Mm. Yeah. Well, maybe let me wrap this up with a question, kind of coming back to our students and or early graduates, but we don't have that many alumni who end up in startup companies like this. There's been a few. I mean, we've had alumni who have started their own companies, drug companies, and obviously those that start their own pharmacies. And so there is kind of this entrepreneurial spirit that a lot of our alumni have. But what advice might you have for students who are interested and just don't know how they kind of get into the position where they might be able to be involved in a startup, either their own or like you, working with a group of others that have invested in the company?
Sure. I think, well, first off, LinkedIn. LinkedIn's really important.
Yeah, yeah. So that's where you were first contacted by
In both
both
situations.
cases. Wow,
Yeah.
that's
Yeah.
really a testament to power
Yeah.
of networking.
Yeah, definitely. And I mean, when you have a unique experience, like when I first started in infant formula, I'm like, I'm never going to use this again. And the reality is, you put stuff up on your page, and you never know, because people are
Yeah,
constantly looking across LinkedIn,
yeah,
and whatever you did might actually be what somebody's starting a company to do.
yeah.
But the other thing, I think at more of an entrepreneurial level, I think really not just taking everything for face value, just because, the way that something's been done for however long is the way it's done.
Mhm,
If you see that it's not actually like helping patients, there's a problem.
mhm.
And it's okay to propose a solution. And even if, like me, like I don't, have a strong, background in finance, but if you start talking about your idea with people people get excited and people will start listening to you, and you might actually run into the right people and they want you to join a business with them or start a business. And yeah, I mean,
Yeah,
I
that's
think
so true.
those are the big things.
What about the risk part of it? Pharmacists are, maybe I'm stereotyping, but risk averse. Um, I
People
think
would say I'm risk averse too.
you're not, but I mean, a lot of people would, get that phone call or email from, whoever saw them on LinkedIn and say, oh, well, yeah, I don't know if I want to give up my, job with a chain drugstore or with Abbott,
Mhm.
which is very secure, to go work for a startup company.
Yes, but with risk comes reward.
Yes.
I will say, before I joined Bobby, they actually went through a recall. So talk about risky, but at the same time, understanding what a recall really means, understanding why the product was, why they chose to recall it in the first place, and also understanding like what is their thinking behind it. The reality is they went through a recall and they ended up locking into a US manufacturer that
Mm,
is widely known to have extremely safe and quality products. The fact that they were able to show their true colors in such a negative situation, and it being probably one of the best ways you could handle a recall.
huh,
And not only showed that group, but it showed me that, these are people that care about doing it right and at any cost.
yeah,
And I think it was an incredible learning experience. And, you know, I mean, the thing is, there's always going to be risk no matter what you do. I mean, I remember when I
sure.
graduated, there was a hiring freeze for like every pharmacy in Chicago almost. And it's like, should I wait and try and get a job at Walgreens that I know will be safe, for the long term, or do I try going into this random job in regulatory in at Abbott in Ohio? And, you just never know where things will take you. But I think the main thing is that being a pharmacist, being a PharmD and having a license, it gets you into a lot of places. So you might think something might be risky, but at the end of the day, it's probably not as risky as you think
Yeah,
it
you're probably
is.
right.
Yeah.
Well, this has been really fun, Christina. Thank you so much for taking time to, um, provide your experience and advice to our students and just to catch up and
Yeah.
hear about your life since you were here. It's great to hear that you've had a son and, you're look very happy and working for, sounds like a great company. So
Yes.
look
Thank you.
forward to hearing the next update.
Yes, I am very excited. And yes, thank you so much for having me. It's been wonderful to catch up, and yeah, definitely we'll keep you updated.